Start and prompt opinion. ARIA is registered on the marketplace as an external A2A agent, so any workspace can consult it directly. There is no glue code required on the platform side. A real geriatric case, 78-year-old male with stage 3 kidney disease, taking warfarin and aspirin. This is exactly the combination that fills geriatric wards. Prompt opinion routes the request to ARIA over A2A version 1, using the same JSON RPC envelope any conforming client would use. A full clinical artifact streams back. The overall risk score, with severity. An interaction table with mechanisms, written in language a clinician can use at the bedside. A risk timeline showing the peak day and intervention windows. A ranked deprescribing plan with rationale and a realistic expected risk reduction. Monitoring recommendations. A warning to reevaluate the aspirin indication before discontinuation. PA summarizes the artifact back in the conversation, completing the agent-to-agent loop. 2 surfaces, 1 protocol, 0 custom integration. Same backend, different surface. This is the clinician-facing web app. 6 medications, warfarin, aspirin, omeprazole, amlodipine, digoxin, and furosemide. 72-year-old woman, CKD stage 3. The risk score is the least interesting part. ARIA explains why. The mechanism panel describes the molecular interaction at a level a pharmacist can act on. The timeline shows when the danger peaks, not just whether it exists. The deprescribing waterfall shows what to remove first and the expected risk reduction at each step. Uniquely, ARIA computes cumulative loads across the entire regimen and detects emergent multi-drug interactions that pairwise checkers miss. Every recommendation is grounded in evidence the clinician can verify. Triage is done by evidence grade, not by alarm fatigue. The reason ARIA can reason like this is its architecture. 3 independently deployable layers, a Rust MCP server with 10 clinical tools and FHIR R4 integration, a Python A2A agent that orchestrates the tools through a LangGraph pipeline, and a Next.js frontend on Vercel. Polyglot on purpose, each layer uses the language that fits the job. ARIA speaks A2A, the open agent-to-agent protocol, so any compatible agent can call it without custom integration. ARIA. Marketplace, Web, Raw Protocol. 1 backend. 3 surfaces. Built by WikiLee. Open it. Test it. Override fewer alerts.